Blog Talk Radio.
Welcome to the Pelvic Messenger, the show that dives into the world of chronic pelvic pain. The Pelvic Messenger brings to you a fair and balanced message of hope. Empower yourself with the knowledge, understanding, and tools to best manage your pelvic problems and pain. My own personal struggles with endometriosis, interstitial cystitis, and pelvic floor dysfunction have led me to be an advocate and a voice for all of the diseases, syndromes, and complexities of the pelvis. It is with great empathy and compassion that I bring this show to you. Enjoy the next hour, and together let us learn and inspire one another. Together we can create real and lasting change. The content of this show and the website for Pelvic Messenger are for informational purposes only and are not a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified healthcare provider with any questions you may have regarding concerns and medical conditions.
Hello, everyone. Welcome to Season 2 of the Pelvic Messenger. I am your host and the founder of this show, the Pelvic Messenger. My name is Elisabeth Oas. Last season of this show proved to me what I really had already knew and expected deep down, which was that we as a community needed this show. That the medical community also needed this show, and Pelvic Messenger really has been able to bridge the gap between patients suffering from the many chronic pelvic pain conditions that doctors and therapists and researchers and holistic therapists are all desperately trying to help. And it's been able to bridge this gap in a really great way. I think the biggest proof is that we ended Season 1 with close to 25,000 listeners, and I know that our first show had just over 100, so it's a phenomenal number. I'm really proud of it. I think that it just really says that together as a community we have been able to do a lot in just 1 year's time. And these conditions, they're mysterious, they're elusive, they're not well known, there's not a lot of awareness, they're very, very enigmatic diseases. And to be able to have a forum with the best of the best here talking, willing to come on the show and speak with patients and answer questions and be interviewed is just, it's an amazing opportunity, and I want to thank everyone who tunes in. I want to thank you for listening and for, telling other people about the show, and it just means the world to me. As a patient who suffers myself with, the whole fruit basket, I like to call it, started out with endometriosis. And my endometriosis thus began a tumbleweed effect of secondary gains, pelvic floor dysfunction, and interstitial cystitis, and then pudendal neuralgia. And then recently I've been diagnosed with systemic lupus, and that's a recent diagnosis that I have not spoken of at all because it happened on the break between Season 1 and Season 2, so we'll be talking about that this season as well. I don't want to get too excited about the 25,000 listeners because we need to still stay humbled. The show has really proved that everyone in this community is so strong and resilient. We as a community are so caring about one another. We're so passionate. And that's amazing. But that number, although big, still proves that we have really a long way to go. And the reason that I say that is because the current number of people suffering from chronic pelvic pain in the world, and this is an international show, so although I sit here speaking to you from Chicago in the United States, there's people all over the world listening to us right now, and that number is 60 million. So when we think about 25,000, although it sounds like a lot, when you think about 60 million, we still have a really long way to go. So it's important that we're starting season 2, and it's important that we continue to grow and not lose focus and stay strong and just keep this ball rolling, because eventually we're going to get there. I really do believe that. So this show is completely different than anything I've done before. I typically have a guest, and we have a topic, and I interview the guest, and I take calls, and that's typically the format. I've been very, very blessed as the show grew to have come across a dear friend, and the sister that I never had, Miss Jessica Tonsick. She is my full-time partner in the show. And then I also have a bunch of wonderful hosts across the globe that come in and do guest hosting. And if you look through the archives, you'll see them there, Miss Danielle Bevan-Jones and Miss Lori Houghton. But today is just labeled Straight Talk. I wanted to do something a little bit different and take all the walls down, take all the pressure off, just be relaxed, and just have everybody be able to call in and ask me questions very directly if you want to, if you're interested in something that I have to say or tell you about from my own experience, or, something that I may know that could help you, or if there's something important that you just want to say that's, burning a hole in you, and you just want to get it out, and you want to say it, and you want to talk about it, and you want to start a conversation. That's what this show is for. There's no guest. You are the guest. I am the guest, and we're just here to talk. So I already see the switchboard blowing up, which makes me super excited. I was a little scared I'd be talking to myself this whole time. But I'm going to start with our very first caller, and he is a phenomenal advocate. He has a really, really great group on Facebook for pudendal neuralgia or pudendal nerve entrapment, which uses the acronyms PNE/PN. And I have Mr. Sean Ellis here today to talk, and this is pretty exciting. I've actually wanted to have him on the show for a long time as a guest, and he'll probably come on again as a guest sometime. But I've got him here on hold. He's my very first caller, so I'm going to bring Sean onto the show, and we're going to talk. Sean, are you there?
Yes. Hi.
Hi, welcome to the show.
Hi, welcome back.
Thank you.
I just want to say we're all glad you're back, and just wish you well in the healing process with all this going on.
Thank you. I appreciate that. I wish that I would have gotten back a little sooner, but as everybody knows, sometimes life is just day by day, hour by hour, and I had a really difficult summer, and so, it was a couple months longer than I wanted it to be, but I feel really blessed to be back and to have you here. So, Sean, if I know there's a ton of stuff you want to talk about, but if you could just, tell everybody what you do on Facebook and all the great advocacy work that you're doing and why you're doing it. What is your own personal kind of thing going on? That would be great.
Yeah. So, basically, I'm one of the admins for a Facebook group called Pudendal Neuralgia, or Pudendal Nerve Entrapment. It's called Pudendal Neuralgia Hope. And my main goal, I guess, and focus right now, my biggest goal in doing is to, bring as much awareness as I can to to not just the entire medical community, to all the patients out there in the world, all the people with pelvic pain who may also have pudendal neuralgia or pudendal nerve entrapment but may not know it. So I spend a lot of my free time, what little time I have, in doing that and helping people with that. So, basically, so I have pudendal neuralgia or pudendal nerve entrapment, and I've had it, for 3 years this month now, actually.
Okay.
3-year month now. So.
Congratulations! I know.
Yeah, congratulations! Happy anniversary, right? Yes.
Yeah, I know. It's funny. Mine got really bad in January as well. So I guess we have that in common.
Yeah. So basically, I started in January 2010 when I was 35 years old. I had pain, in my urethra even after, I was done peeing, and all tests for bacteria were normal. I went to ER and many doctors, and basically 2 weeks later I had, pain sitting and when not sitting in my perineum, and I've been on strong antibiotics for it with no improvement. And still having the urinary frequency urgency and peeing every 30 minutes for 2 hours, every 2 hours.
So your bladder you were suffering from some really bad bladder spasms then, and did they mention the words ICT? Well,
2 years ago, what they told me at the ER, the first thing they told me was they thought I had prostatitis. There's never any infection, never any fever, all the urine tests are normal, and cystoscopy was normal, so everything else was normal. And I also had something else which, some of your listeners may be familiar with, but not all of them, but it's something called PGAD, which is persistent genital arousal disorder, which
we're going to have a couple shows on that this season. So, but I assume that there's probably a lot of listeners out there that don't know what it is, may have it, and not realize they have it.
They may have, but they've never heard of that term, or know they have. So it basically wasn't until I was finally prescribed diazepam, otherwise known as Valium, which relaxes the pelvic muscles and allows the muscles and the nerves to heal. And so that kind of, reduced my urgency to have to pee, and kind of calmed and down the weak and stiff muscles that I had. And I finally got 95% better, actually, by May of that year. So I thought, I was better. But then a few months later in August, I actually stood up against the current of a strong current of the ocean from a squatting position. And when I stood up, I instantly felt a pain in my perineum and where my adductor muscles are, and all my urinary problems and my pain came immediately back, and it's pretty much staying about constant since then. So, and then it took me a while to figure out what was going on. The urologist didn't know, and finally I saw an orthopedic doctor who knew about pudendal nerve entrapment, and I got the pudendal nerve block test done, which confirmed it was pudendal neuralgia or pudendal nerve entrapment. So,
so this was all within about a year's time, would you say?
Well, I mean, to get from the time
to get your diagnosis, that's not too bad.
The diagnosis was probably about 8 months, 9 months, but that's
really
not
good.
That long. Well, it's actually not that long to consider that. Most people it takes anywhere from a year to 10 years at least.
Absolutely, absolutely.
I mean,
with endometriosis, something that is a term that most people have heard and know, and certainly in the medical community, we're still in a 10 to 12-year diagnosis process. I mean, it has not gotten literally any better. So I'm glad to hear for you that, 8 months. Listen, it's not fun being in pain for an hour. 8 months is a long time, so I'm in no way trying to be dismissive of you being in pain for 8 months. Right, but I'm glad that you were at least able to have somebody even know what the nerve was to at least, give you the diagnostic
It's pretty lucky.
block, to say so.
Yeah, I've come to learn that actually it's not even where the pudendal nerve block test is actually, a test that is done pretty much in, most, major cities, I guess, or, so I was just pretty lucky, I guess, to even have that test available or somebody there to do that test, so,
No, that you're absolutely right. You're absolutely right.
It all went away, all the pain went away as soon as the test was done.
Okay.
Pretty much just a diagnostic, test to see if it takes away your pain in the area, so, and it did.
So you've called in. You're a really strong advocate. I mean, I see you on Facebook all the time. Putting out beautiful prayers and messages of hope all the time, and great information. You're a very good writer and a very good researcher. So I guess what are you doing right now as an advocate that you want to tell everybody about, or if you don't want me to go quite there yet, is there something within the diagnostic process as far as that just gets your fire going? I mean, everybody has something different that they want to call in and say today, so I want to leave that up to you. I mean, I'm kind of going back into my old ways here of just starting to ask questions. I guess it's just so easy for me to do, but at the same time, I want to keep this forum open to you. So go ahead and go into something, and I'm just going to let you talk, and then I'm going to keep you on, but put you kind of on hold and take this next caller, which is area code 770. Everybody's anonymous on here, but they've been on hold for 19 minutes, so I'll take them after Sean says something else here. So.
Well, first, I just really would like to start by saying I really do feel like the entire medical community has ignored the pudendal nerve and pudendal neuralgia and pudendal nerve entrapment for way too long. And I feel like now it's definitely a time for it to come to full attention. I feel like, it's been ignored for way too long. I feel there are many reasons why, every single urologist, every single gynecologist, neurologist, neurosurgeon, plastic surgeon, they all need to be and should be trained and educated about the pudendal nerve, pudendal nerve entrapment, and pudendal neuralgia in med school and residency, and in the required annual training meetings they have each year, because it basically affects all the different fields. They just don't realize it. They've never been trained on it. They don't know about it. And I know that from firsthand experience from seeing all the different specialists. And also, I have some great, outstanding, neurosurgeons and actually former presidents of the American Neurological Association in my family.
Oh, that's amazing.
They had actually never heard of the pudendal nerve until me.
Well, there you go.
Or pudendal neuralgia, or pudendal nerve entrapment. So that just further, proves my case about how there really needs to be fundamental changes made right at the core, starting at medical schools, going from there going to the American Urological Association, American like I just mentioned, all those different associations. So they really need to be trained on what the basics of it are and how to recognize it, how to diagnose it, how to treat it, because if every one of these specialists knew what it was, and they had a patient come into their office with these symptoms, they could very easily recognize it and do the test for it, and get the patient at least the medication they need it for it right away, instead of them having to wait a year, 2, 3 years, or whatever, without even a diagnosis or even the right proper treatment for it.
Right, because by the time the body's been in pain for that long, now you're dealing with a whole new monster. It could go into something further or worse. It could worsen your symptoms, actually, if you have, severe urinary problems. It could, worsen your bladder problems and,
And, that's the other thing is, that I wanted to get into is I feel like, there's so many different other things that they are familiar with, like prostatitis, which is usually acute, which, by the way, there's thousands of men who each year get prostatitis, but yet, most of them are, over 75% of them are non-bacterial, so in those cases, in my opinion, I think a lot of them are actually related to that's what I was first diagnosed with, actually, yes. So I think actually a lot of these men who get it, who aren't, it's not really, true acute bacterial prostatitis, which usually has, fever associated with it. I think a lot of those cases are actually, related to, either the pudendal nerve entrapment, pudendal neuralgia, or something else with the, the nerves in the pelvis. So.
Yeah, no, I would agree with you. It seems like prostatitis in some cases, many times, is kind of what they would call like a garbage pail term for men. Like, oh, these are your symptoms. Well, that's what it is then. Same thing with women. Oh, you have a UTI, and then it. We hear this all the time.
Especially where there's no evidence of any, infection or in the urine sample or anything, that the cystoscopy is normal, and that's the thing, as far as people with IC, who are diagnosed with IC, they really need to delve deeper and to see, what was the underlying condition which brought about the IC, because, as far as I'm aware anyways, people who are diagnosed with IC as their final diagnosis are, they don't even have to have a cystoscopy that shows, anything wrong with the bladder. As far as I'm aware,
well, there's very, very good, clear guidelines on AUA.com, the American Urological Association, and they came out in 2011, and this was a big, huge deal, and we have to give the ICA a huge amount of credit for pushing this through for patients, just to be able to have guidelines. When you don't have guidelines, there's nothing for doctors to go to look. And so, it just makes the problems, all that less, quote, real for the doctor's end, for the scientific end of things. At least now there's like actual guidelines that they can go look at and see. And you're correct on the cystoscopy. It doesn't, just because they don't see a ton of Hunter's ulcers is what they call them, or, a lot of lesions, doesn't necessarily mean that you don't have it. And this is where I say these boundaries are, and these borders are very kind of skewed and gray. There's still a lot of gray area there. However, I think with more research and maybe getting some guidelines with pudendal neuralgia, then the IC guidelines will get more specific.
The guidelines for IC, do they test to see if you have pain in your perineum, which is the area between your rectum and your genital area?
You know what? I would have to bring it up online.
I read that was actually one of the symptoms they used. That's actually more of a symptom of pudendal neuralgia.
And it is a symptom of IC. That definitely is, and it makes sense. Everything is all together in that same area. It's also a symptom of endo. It's also a symptom of a lot of things, and many diseases out there have crossover symptoms.
There's also the separate pain area of the bladder, which is very kind of close to the perineum, so it's a kind of a separate pain area, bladder pain. But I'm trying to figure out, the pain between your anus, right from that area to your genital area, that's basically where your pudendal nerve branches are, your perineum,
right, but there are other branches that kind of move, and it's not a mere image, either from front to back.
If people have pain in that area, they definitely need to kind of explore. Well, maybe they have pudendal neuralgia.
I agree with you. I completely agree with you.
For that, you know what I'm saying? So.
No, I definitely agree with you. The only point that I'm trying to make is that since there are guidelines now, and because the IC guidelines to some extent can be kind of a gray area, I think that what people and doctors and patients need to do is be educated on all of these things, because I'm a huge advocator of eventually the pain is just a pain, and it starts to just become chronic pelvic pain syndrome. And I know that sounds broad, but to some extent, after a while, that truly is what's going on. And it's if you get stuck in a rut with I only have IC or I only have PN, you might lose out on some opportunities for treatments that could possibly help you. And not everything, as we all know, not everything works for everybody. But at least if your mind is open to the broadening of the diagnoses and looking into those things and trying some other things, then at least you're opening up some other possibilities for yourself.
I would say, based on, from people I've talked to and from what I've heard, that people are actually even lucky to get the diagnosis of chronic pelvic pain syndrome.
That truly isn't a diagnosis right now. I mean, that really isn't a true diagnosis. I mean, like the founder of the IPBS, Fred Howard, I mean, he's an advocator of that diagnosis. And if you read his book, which is the book that doctors read when they are interested in treating these problems, it makes a lot of sense. But Sean, you and I could talk forever. So I have to take some other calls. So hang on there for me. Don't go anywhere. And I'm just going to take this caller here. So 1 second. Hello, caller. You're on the air with Elisabeth. Hello?
Hello?
Hi, you're on the air with Elisabeth. Thank you for calling.
This is Lady Grace. I'm in Gainesville, Georgia.
Oh, hello, Lady Grace. What a beautiful name. How are you tonight, and what would you like to talk to me about?
Well, I've had pudendal neuralgia, and I've had it for going on 3 years now.
Okay.
And we've been through doctors, the whole line that everybody else goes through. The only thing is not the surgery. And I wanted to ask you, have you had acupuncture? Have you tried acupuncture?
Yes, I've had acupuncture at many different points in my life. I would say it was most beneficial for me prior to the whole tumbleweed effect, like in my early 20s when it was pretty much just endometrial problems, when it was when the pain wasn't just everywhere and I didn't have every single diagnosis known to man. The acupuncture was extremely beneficial at that point for me. I've done it several times beyond those days, because I'm 37 now, and it's definitely helped. I wish it would hold a little longer for me. That's just for me personally. For me, and this is just for me, the acupuncture tends to make me feel really good for that day, and then I just feel like, geez, I need it again. For me personally, I find that Reiki and hypnosis in my recent, like the last 5 years, have been holistic therapies that for myself seem to hold and keep down pain for longer. And I don't know what those reasons are, but what I do know about holistic therapies, alternative therapies, there's all kinds of, integrative therapies, there's all kinds of little terms that people have for it. But what I do know is that you got to just kind of go out there and try some, because what may work for one person really, really well may not work that great for you, and then vice versa. But acupuncture has been around forever, and it's still done in the hospitals in China. It's considered a good therapy, and it is recognized by the National Health Association here in this country. Insurance plans, unfortunately not mine, but many insurance plans are paying for it. and most of the top hospitals in the country are offering it to patients. So that being said, on a kind of Western scientific level, you can say to yourself, yeah, there is something to this. Otherwise, we wouldn't have those things happening that I just listed. But what acupuncture does is it works with the energy cycles within your body, and they have all these different peridiums, and it's a very, very complex. I'm not an acupuncturist, but I did do a show on it, and it's with a gynecologist, and that was the last person I had acupuncture done with was actually this gynecologist, and her name is Dr. Tara Gustillo, and she was on the show, I want to say probably in May or June of 2011. You can look back in the archives, and she's a gynecologist who specializes in chronic pelvic pain. She's in Minnesota, and she does acupuncture on her patients. And I had great results with her, and I don't live there anymore, but if I still lived there, I would have continued to get acupuncture from her. I say go out and try it. But the thing is, Lady Grace, it's not going to hurt you. It's not going to make anything worse. And that's the nice thing.
My pain meds, heavy pain meds. I got tired of being doped up all day. So I've been off that for about 11 days. I'm seeing a pain counselor and a chiropractor. And I've had injections in, injections out. I've had pelvic floor rehabilitation. We've been through so many things. And the similar stories are, of course, that the doctors have never heard of it, and they've done all they can do. So we're just trying something new. So
I understand.
Did you stay on ice? Have to stay on ice all the time? Have to sit on ice all the time?
Yeah, I'm on ice a lot. Coming off your pain meds, do you feel like your pain is the same, or do you? It's probably too early to tell exactly what your baseline is, because right now you're.
I do feel like it's about the same. I'm just mentally trying to control it better, and I actually like not being drugged up.
Absolutely. I'm looking forward to the day where I'm not on pain medicines as well.
Yeah, so, it's hard. It's very hard.
Yeah, I want to just say that I'm proud of you, and that's hard. And at the same time, just know that for some of us, for many people, the pain medicine is there for a reason, and so don't be too hard on yourself if there does come a time where you have to go back on it. I mean, because this happened to me, and I really was hard on myself about it. I was like, man, I was off of it for this long, and I worked so hard, and actually my pelvic pain had felt a lot better. Because it does happen where your pain starts to get a little bit compounded because of the narcotics, and so it's hard to tell really what your baseline pain is after a while. And so I'm really proud of you that you're.
I want to hold up the line. I know a lot of people have questions, so I thank you so much for your work.
Oh, you're so
welcome. And your influence on so many other people also. Thank you. And
thank
Jessica,
you so
too.
Much. Yeah, she's a doll, isn't she? All right.
Okay.
Thank you so much, Lady Grace.
You.
I love your beautiful accent. Okay, bye-bye.
Thank you. Bye-bye.
Hello, you're on the air with Pelvic Messenger. Hello? Area code 801. Hi, this is Elisabeth. Hi. How are you?
This is Arlene Jones.
Hi, Arlene. Oh, I'm so happy that you called. It's nice to hear your voice. It's always on Facebook. So thank you so much for calling in. I'm just got a big grin on my face right now. So what do you have to say here today for Straight Talk? I know your personality, so I know you're going to say something good. Let's hear it.
I'll try not to say something bad.
No, it doesn't matter. It's just us here today, so you can say whatever you want. I put the show in as mature, so we're all good.
My biggest beef is the blatant treatment of doctors to their patients who have come in with these symptoms, and they turn them away crying and leaving in desperation because they told them that it's all in their head.
Yeah.
Now,
and to have that happen it creates so much more trauma for the patient.
Oh my gosh!
I mean, it makes the pain quadruple.
Yes.
You know, we're all one body. You know what I mean? So you can't have something like that happen to you mentally and not have it affect you physically. It's all one body. That type of trauma, I don't even think it was for me personally. It wasn't until, very, very, years later until I figured out, like, gosh, these particular experiences really did a number on me, and I at that point decided to go and get like some really heavy psychotherapy done to get over those experiences. And gosh darn it, I don't know, I wish I would have done it sooner, but when you're going through it at the time, you just get mad and you're sad and you're crying and you're frustrated, and you're not thinking about at that point, you know what, I need to go take care of what just happened to me mentally so that I don't get worse physically.
Yeah.
But then later on, then you're kind of playing catch up with it,
Yeah. Well, I had a hysterectomy in 2008.
Mhm.
Just a simple procedure. And I woke up in the most incredible pain that I could ever imagine. And my feet were shaking back and forth. And I asked my doctor, I said, oh, my gosh, what happened? Is there something wrong with my bladder, my urethra?
Right.
Did something go wrong? Oh, no, you're just fine. You're just fine. There's nothing wrong with you. When I went into
how much farther out, because our uterus holds up our bladder. So the bladder is the first thing to hurt after a hysterectomy. And I mean, most, I would say, gosh, I mean, there's got to be, I don't know what the percentage is. I'm not going to say it and then have somebody correct me later, but there's a huge percentage of people that their bladder just absolutely kills them after hysterectomy. I know mine did. And at that time I didn't have the IC diagnosis, so now I know even more why 3 months later mine was still killing me. But the uterus holds it up, and then on top of it, if you're a person that's going to be sensitive and maybe have some underlying bladder problems, then you have that surgery done, and that bladder is just spasming, and it is not happy, and the pain is just crazy. You've had a urethra up there the whole time during surgery. That has now made things sensitive. And going into that surgery, obviously you didn't know any of this going in, right? And then you don't have a doctor explaining it to you afterwards.
And they've got you all stretched out on the forceps. And it was my understanding that can be a problem there. Yeah. That they can overstretch the nerve, especially if you have a small pelvis like I do.
Yeah. Yeah.
Well, anyway, when I went to his office, he became angry with me and said, "What are you trying to say? I hurt you?" And I'm like, "No, I just want to know where this pain's coming from. We're talking a year out." Right. And with good reason, And I was so angry. I didn't go back.
Of course not.
Then I went to a year-old gynecologist, and they blew up my bladder and my urethra, and they said they don't see anything. And then they patted me on my knee and said, "Why don't you just get some rest?" And I thought, they think I'm nuts.
Right.
And it wasn't until I've been searching the internet for a long, long time, and I came across Pudendal Support Group, and it was started by Mitch Hardesty.
Okay.
And I opened it up, and almost every single person in there had the same symptoms.
Yeah.
And I just broke down and sobbed because I started to think that I was going crazy. And I finally got a hold of a doctor at the University of Utah pain clinic who does not treat PN, but he knows about PN. Okay. And he knew how to do the prick test, and he specializes in pelvic floor dysfunction.
Okay.
And he knows Dr. Hibner in Arizona very well.
That's good.
So he pretty much was on top of things, and he said, "You have PN." He said, "I'm sure you have it. You have every symptom, everything."
Right.
So he started treating me. But that was 4 years out.
Right, exactly. And this is the problem. I mean, had that doctor originally just, taken you seriously and thought, okay, you know what, this isn't normal a year out. Let me think about this. I think sometimes it's like any profession in life. Any profession that you can think of, there's going to be a huge chunk of people that are not good at it. And then there's going to be a smaller number that are exceptional at it. And when it comes to chronic pelvic pain, when you just do the arithmetic and put it out on paper, we've got about one good specialist per 12 million people. So we're not in a good, this is, it's going to be more common to have what happened to you, and we all have a story like that too, and that's what is infuriating and makes me continue to do what I do, and made me just start Pelvic Messenger. Originally just started as I lost my acting career. I didn't lose it. I'm still an actress, and I'm still a union member and all of those things, but I can't work. I can't commit and go audition and be on sets and have the things that I have. But what I just took a site that I was already paying for and decided, gosh, I'm going to create a place that people can come to and find all the information I wish I would have found, kind of like what happened to you when you came across the support group, right? I wish that I would have found this, and so what those things were in my head, I put into the website, and just hoped that, gosh, if it could help one person, if one person came across it, and it sped up the process from them from being 4 years like yourself, or for me it was 2.5. Actually, it was 23 years to get my endometriosis diagnosis. And then it was 2 years to get all of this other stuff, figured out. But I thought if I could, if it saved one person, a year or a month or whatever it is, then I'm glad that I did it. And consequently, it was helping a lot of people, and I was getting emails, and just one thing led to another, and then the show started. But the stories, like you said, with the gynecologist, I cannot tell you, especially in the endometriosis community, how many of stories like that I have heard, and I've been through the exact same thing. Like I said, there have been some experiences that I've had, particularly in emergency rooms, that literally left me with post-traumatic stress syndrome. And it's really, you go for help, you don't know what's wrong with you, and then to be dismissed like that is it's just so hurtful. But you know, God bless you that somebody was looking out for you, and you came across this support group, and you came across the doctor that you did, and that's what I want to say. I always want to spin this into a positive. You know, you came across. What is your doctor's name in Utah?
Howard Sharp. He's one
Howard
of the 50
Sharp.
top.
You came across Howard Sharp. You know, so there's an example where God was looking out for you.
Yeah.
It
me.
took a while, right? You know, exactly. But like you found Howard Sharp, but there's still all these other people who have not found their Howard Sharp.
There was just one thing I wanted to really tell you really quickly.
Mhm.
There's a little gal who lived in Ireland, and a Mormon missionary met her, and they fell in love, and they got married, and his family lives here in Utah. So he brought her here because she has pudendal nerve.
Wow.
And he thought with his family, you know, she would have support and everything. And they were in Arizona first, and she was being treated well there, and her doctor in Arizona wrote her a note saying that this is what she has, this is how I'm treating her, please help her, you know, in Utah, and blah, blah, blah.
Okay.
Well, the doctors here in Utah told her they're not buying it, that she's just seeking drugs, and that she needs to go to a drug rehabilitation center. And my two doctors that are helping me are not taking any patients. And she cannot find a doctor anywhere who will take her, because they look at her records now that says, oh, she's just an addict.
No, that's. I mean, that's so not right. I mean, I would suggest. Have you told her about the IPPS? Because I mean, this is the group that you know, I just cannot say enough about and support enough.
I do not really know about the IPPS.
The IPPS is the International Pelvic Pain Society. And here in the United States, they're a group of, I think, I don't know, it was about 500, and I'm sure it's more now. Back when I got kind of started with them, it's only a medical group, but because I'm a national patient advocate and I have a show and I'm a medical journalist, that's how I became a member. But we're actually, in the future, we're going to be starting patient memberships, but that's a whole other show. But anyway, this group of doctors, this is what they do. And there's a really beautiful show about how this group got started, and the doctor's name is Dr. Fred Howard, and it's in the archives, and I suggest you listen to it. And the website for them is www.pelvicpain.org. And you can email through there, and you can put care of the patient corner, because I take care of that section of the website. And you know, give her the information, and I can speak with her directly through email. And then what I do for this association is I take a patient like the woman that you just spoke of, and I take her information, and then I put it out there throughout the group, and I try to get referrals for people and help for people. And so I really would like to help her, and so if you would just pass along the IPPS information, you can find it on the Pelvic Messenger website. You can find it on my website. And that would be a really good first step for her.
I will do that right away.
Yeah. It sounds like she has a really supportive husband too. And there's quite a few, rather than going to a inpatient treatment facility for her to be with a group of people that it makes no sense, rather than doing something that ridiculous, it would make more sense for her to travel to one of the treatment centers. There's 5 really, really good ones. The one that I always advocate the most for is the one that I've been seen at for years, and I haven't been in about 6 months because I'm doing pretty good in the pelvic area, but I've gone for sometimes 3 weeks, 4 weeks, and they take people from out of town all the time, and they specialize a program in that. That's in Michigan, and there's other good ones. There's a couple in there's like 2 or 3 in the California area. So there's a lot of other options for her. If she did, in fact, want to go inpatient somewhere, have it be somewhere that's going to treat her pelvic pain and help her. Not here, let's sit around and talk about alcoholism and get you off of, quote, drugs. I mean, that doesn't even make any sense for her. She needs treatment. She needs, like, actual medical treatment for her pudendal neuralgia. So, going to a facility that would help her with that would make the most sense. I mean, this girl, she needs to get her team in place. She needs to get a PT. She needs to find a holistic treatment that she likes. She needs to get a diet that works for her. She needs to have a doctor. She needs to have a pain doctor. She needs to have all these people in place. And if nobody's willing to do that, then, she needs to seek out the help of someone like myself and an organization like the IPPS. So, and the ICA as well is a great patient organization that can help with referrals. So, definitely tell her those things, and you can send her directly to me. So,
all right, that'd be great.
All right, Arlene.
All right, thanks so much.
Okay, I don't want to cut you off, but I want to get to, there's a couple other people here, and thank you so much for calling in.
All right.
It was just lovely to speak with you live and in person.
All right, thank you.
All right, bye-bye.
Right. Talk to you later, bye.
Good evening. Hi, this is Elisabeth, the Pelvic Messenger. You're live on air.
This is the other Pelvic Messenger.
The other. Hello.
Yes. The other Pelvic Messenger. Yes, I definitely had to come on and support you. I'm just so proud.
Thank you so much for calling. That was so sweet. Oh my gosh, I'm so happy to know it's you.
I mean, I'm just so proud of you. I mean, just knowing personally, everything that you've gone through in the past, 6-7 months, this is awesome. It's like making a comeback, and it's just saying, I'm going to get back on my trampoline and try to jump high. So I just have to give you props for that. Yeah, definitely. I mean, it's a lot of people. I just want to go, and you kind of know more about what's been going on with me, but one of the reasons I wanted to call in, too, is just to, make it public to the pelvic pain community that does tune into the show, what happened to me. Because, Elisabeth, obviously you've come on to say, a little bit about what you've been struggling with, but as, people that have visited our website at thepelvicmessenger.org, we've been on sabbatical for quite some time now, and obviously
much longer than if we were an actual sitcom. I like to put it into seasons and think to myself, okay, we're going to take our break. We've got 50 shows. Listen to the quote reruns, which are the archives, and then we're going to be back in the fall. And then both of us, it's like, hello trauma. We can't get back. So we haven't actually talked about this at all. So I'm glad that you called.
Yeah.
And we can go there. Yeah,
absolutely. I mean, it's the desire of our heart as messengers for the chronic pelvic pain community, obviously, to continue on and on with, to get this ball perpetually rolling forever and ever and ever as, medical treatments and different other kinds of modalities evolve. Well, we want our show to evolve too, and sometimes that's just not possible, Elizabeth, when, we're suffering too. You know what I'm saying? Don't you agree?
Yes, I would agree completely. It just happened last week, and I was in tears about it, but I tried a new treatment and thought it would be okay, and my body had a bad reaction to it, and thus here I'm saying to myself, gosh, I'm already rescheduling what's the first show of the season. What a loser, and I'm feeling so bad about it. You know what I mean? It's like, but
you have the big L across your head,
seriously, it's like, okay, I haven't even started the season, and I'm already like, well, gotta rebook this one,
Well, it's like in our hearts, we want to do so much more, but it's the brain of the chronic pelvic pain sufferer can only go so far. I mean, wouldn't you agree? I mean, I think everybody out there listening would agree. If you're not even suffering with chronic pelvic pain, say you're a medical professional, you would have to agree, if you care a darn about your patients, that for a patient in chronic pain, it takes like all of your power in your whole body to even like stay awake, just because you're fighting the pain so much. And then you've got kids, you've got jobs, you've got spouses, you've got finances, you've got this, and it's just sucky.
Yeah, absolutely.
Yeah.
It is. It's super, super hard, and I found this summer with what I was going through with my GI system, and I don't know how much people know or don't know. I'll try to Reader's Digest this for everybody, because everything, Jess, but not everybody else does. For about a year now, actually ever since I started Lupron, I started the drug Lupron and was on it for about 6 months, and while I was on it, I started having just these terrible GI attacks where I was having upper left quadrant pain, and I would get insanely nauseous and just throw up to a point where I'd be in the hospital for a few days. And this continued to happen and got really, really, really bad over the summer. And I actually spent all total, like not one after another, but all total, 40 days in the hospital, and had several scopes. And basically all the scopes just kept showing inflammation, a little bit of erosion, and that's from being on Motrin since I was born, but no, literally since I was like 12, 14 years old. Like, you start your period and you have endometriosis, and you're on Motrin, and so I can't take NSAIDs anymore, like at all. I'm things are just eroded in there, and it just cannot happen. But it just kept all leading to this, like, inflammation, bad gastritis, chronic gastritis, gastrophonesis. I mean, these are the terms that are being thrown out at me, and yet there's just not really much to do about it. So I had a really good nurse that let me know about a gastritis diet, which I've had actually 3 different GI doctors kind of laugh at as if it doesn't exist, and it's silly. But I will say I did it for 3.5 months, and it's basically like just all pureed food and canned food, and it got me a lot better. So, but I still was having these, I call them flare-ups, just for lack of a better term, instead of it being a pelvic flare-up, this kind of GI flare-up. And we all know everything's connected, so you can't have an inflamed GI system and then not have your bladder get going, and then not have your nerves kicking in. Like, that it's a tumbleweed effect. So once the GI is inflamed, and then your bladder starts spasming, once that bladder starts spasming, then the pudendal nerve's like, me, I'm going to join the party too, And once that gets going, it's just impossible to think, to live, to do anything, and you just end up in the hospital, and that's how it goes. So
absolutely.
I started having some non-pelvic GI-related pain, and this was specifically in my fingers and in my knees, and I have no prior injuries to my knees at all. I'm not an athlete by any means. I've never had any surgeries, and I don't. There's nothing that I do with my fingers that I would have this kind of finger pain in both hands. And I was having this insane fatigue that I can only relate to when I had mono in college. Like it's not just like you're tired. It's like this, you must sleep. You can't even keep your eyes open kind of fatigue. And so I went to my internist and, told him about this, and he ran some tests, and a whole set of tests later and a couple rheumatologists later, and because lupus is a tough diagnosis. I had the lupus markers right away. I had a positive ANA scan, which is the first initial test that they do, and then after that they go into much more detailed tests, and these tests take weeks to get back, and you have to go through many of them, but it's very, very, very clear. I have systemic lupus. It's not a terrible case right now. It hasn't affected kidneys, but lupus can go anywhere in your body and affect literally any organ system, and it causes a ton of inflammation. And so I want to put this out there only because we talk about inflammation all the time with our pudendal nerve. We talk about it with interstitial cystitis. We talk about it with endometriosis, about how all this inflammation and all the problems that it causes. And so you have to start asking yourself, like, why am I having this inflammation? Well, if you're having it because you have endo, then that's the reason you're having it, right? Because you have the endometriosis. But if you have it because you have pudendal neuralgia, why do you have pudendal neuralgia? Like, you have to figure these things out. So
and the thing that's so hard.
I just wanted to say no, it's fine. I just wanted to say that, hey, you know what? I had kind of closed my head to other diagnoses, and this goes back to something I was saying early on in the show, which is always keep your head open to other possibilities, and don't always just maybe, pigeonhole yourself in one diagnosis, because I had never thought about, the fact that I might have lupus. I've thought about autoimmune because we've talked in support groups, and there's been, talk with research that possibly endo could be autoimmune related, and maybe IC could be autoimmune related, but it hasn't actually ever been proven. And I have always suffered from very sensitive skin on my face and gotten these rashes, especially when I would flare. But lupus never came into my head. So, you know what? Maybe all of us, just as a standardized test, when you're looking for why you have all this inflammation, should ask your doctor, you know what, run an ANA scan on me. Let's make sure that there's not something underlying going on. There's a lot of different autoimmune disorders, not just lupus. There's all kinds of them, and a lot of them are connective tissue related, and I plan on doing a show, probably a couple shows on it, but it's something to consider that's out of the realm of what we've spoken about on this show.
Everything that you're saying about thinking out, keeping an open mind as to what really is going on in the body is just completely accurate. I mean, let's look at my situation here, okay? I don't even know where to start. I feel like, if I could, I feel like I'm looking at a circle.
Look at it, yeah.
Yeah, it's like,
right.
Let's look at the circle of complete mess-ups. It's like I started from the wrong end. bottom line, this is obvious. We need better diagnostics, but we need, and, you and I have spoken to members of the IPPS that we're in contact with about this, and this is a huge thing with them, too, is what they're hoping for and trying to do is we need more pain management specialists involved in this. There are too many people in pain. Pain changes our brains, and I am a complete, on paper example of that because I've actually developed, unfortunately, complex regional pain syndrome, also known previously as RSD or reflex sympathetic dystrophy. Now, this is a disease of the whole nervous system, and you could. It is something that it's like Pudendal Nerve Entrapment was enough for me. It's like I felt like I was the expert in that. I can write a textbook on it. But, just like you could write a textbook on endo, you suffered for so long with that. But now here you've been thrown systemic lupus. I've been thrown CRPS. It's like, what, now we're looking at these diagnoses that are so complex, and yet, nobody is putting the picture together for the most part except for us. And that's not right in the American healthcare system, in the world healthcare system. This is ridiculous. This is what we pay physicians to do. Okay, all the physicians listening would probably agree with me that are, invested in chronic pelvic pain is that, we have got to get more people who know about treating pain and treating pain well to do this.
Without a doubt, I know for a fact that the IPBS would love to have more pain doctors as members, and that's something that I want to share something really positive. I was speaking with Stephanie Prendergast last night, actually, and she told me that at this year's conference that unfortunately you and I weren't able to be at, but we'll be in Orlando, they had their highest number ever. It was almost 500 people. It was, I think 480-something. And, the very, very first conference they had, I'm trying to remember from Dr. Howard's interview, I think he said there was like 50 people there, maybe not even. So, I have to think to myself that, the tremendous amount of promoting of the IPBS that you and I were able to do and having the amount of listeners that we have, hopefully, patients went and told their doctors and told their pelvic, I'm losing my words right now, their PTs, their physical therapists, and told, said, please, can you look into this and go to this conference? And let's hope that was part of the reason why it doubled in numbers from the year before. And let's hope that it triples and doubles and just keeps going and going and going, that this has to be a partnership. And it was really nice. It was really great to talk to her and all of a sudden just have a light bulb go on and say to myself, wow, you know what, ever since this partnership happened, our listening base went up dramatically. So they've helped our listening base. And I'd like to think that we helped their conference attendance. This is what needs to happen. You can't have one doctor per 12 million people.
No,
unless we start having medical practitioners really, really aware and really, really invested in what's going on with the suffering, nothing's ever going to change. And we can help each other by bridging this gap, and that's what our organization is doing. And it was just nice to have that, Oprah aha moment and say, wow, it's working. It's working. It's not fixed and it's not there. But just to know that in the year that we have been doing this, a year is not a very long time. It is just not.
No.
But in 1 year, we were able to make a pretty good jump and a pretty good push. But it's not enough. It absolutely is not enough, and so much more needs to be done. And it gets to be overwhelming when you think about how much more needs to be done.
Yes.
But I'd like to think that, in your comment that you made, you're absolutely right. Like, the patients are the ones doing the work. I always just want to say that is correct, but let's always put it into a positive that we're helping them do the work by doing this show. And every single doctor that comes on here and every single doctor that is a member of the IPPS or organizations like the IPPS in other parts of the world, they're all putting the effort forward as well. And so, it's so easy to take the traumas that we've all been through with certain medical situations. Like I said, I've been through some that literally gave me post-traumatic stress disorder, and it's so easy to just focus on that, but you have to cognitively think and switch that and just say to yourself, but you know what, there are good physicians out there, and there are people that this is their whole lives, and this is all they think about, and this is all they want to do is help this community. And by showing the support to them, just it gives that universe, that energetic universal connection where something good will come of it. And we've seen it happen. We've seen it happen this year, from going from the first show of 50 listeners to almost 25,000 listeners, and having a conference, double in the amount of medical practitioners at it. That's a big deal. So,
it is.
I just wanted to throw that out there because it's really easy to just continue to be frustrated. And last week I was so frustrated and so angry last week when I had to cancel the show. I just thought to myself, well, why am I even doing this show? I can't even do it, And it's really hard to just get out of that rut. It's really hard. But then tonight, having these moments and talking to the people who called in and having you call in, and it puts it into perspective what we're doing, and it just, I don't know, it warms me up a little bit. So that's really a lot.
I don't want you to I want you to be able to take some more calls. So I'll try to wrap myself up here because I have to take care of some things before
we're okay right now. I'm going to go back to Sean, but we're fine right now. There's I don't have any other people on hold right now. So if you want to just quickly, I'd like you to talk about your ketamine treatment. So
sure, I don't have much time to talk because I am having more treatment tomorrow. But I did want to say, I have to honestly say I'm really proud of Dr. Hibner in Arizona for his vested interest in ketamine infusion therapy for patients that have pudendal neuralgia and or CRPS stemming from pudendal neuralgia. Unfortunately, this was not yet implemented when I had the transgluteal surgery back in 2010. But, I have to say that, it's great that it's being implemented now, at least somewhat in the pelvic pain community. I just have to say that it's just a whole new world of misery. It's the same thing. It's like you're fighting to try to find out who's going to treat you, who's going to take your insurance, where you're going to go. It's debilitating. It's a terrible, terrible thing. And honestly, that's, I have to say is that, a lot of people I just have to say this, so many people from the Pudendal community, even people that have read my blog, which I haven't even posted on for 5 months, they've been contacting me and, like, I'm a mother. I got pudendal neuralgia from having, you know, my child. Can you help me? Can you, you know, I heard you went to Austria and had surgery with Dr. Osman. Are you better? I have not been able to respond to these people because I have been so incredibly sick from CRPS. I mean, it's just.
And do you think, Jessica,
like,
do you think that this was something that was lingering in your body beforehand and then just came to the surface with the pudendal nerve being
entrapment? Like before I had my baby?
Yeah, do you think that maybe no, okay. Just wondering, because I actually don't know that much about it except from what I know from you
what I do know, I can say is that it definitely came on after the transgluteal surgery. It was only it only spread to the left foot originally, and I had the TG surgery on the left side. So it was just in the left foot, kind of in the left leg. We weren't really sure that's what it was, but I had a little bit of ketamine when I was out in Phoenix for a visit for some follow-up treatment with Dr. Hibner. And, you know, he pretty much said, you know, I think you might be, you know, having some symptoms of CRPS. But I still had so much pudendal nerve pain because, you know, come to find out, you know, the nerve where I had the entrapment was, you know, it was distal, and
right.
Yeah, I needed to have the transperineal approach that I had in Austria all along. So, you know, I mean, guys, I flew to Austria. Okay, thank God I did. But we've visited this on the show before with other doctors. You know, we've got to get more people doing this in the United States. That's obvious. But you know, as far as the CRPS goes, it's spread because when I went to, because with CRPS, what I know is that whenever your body has another big injury to it, like a surgery or you fall, there's a chance that it can spread. Well, so I didn't know that because I wasn't really officially diagnosed. So I go to Austria because I'm in pudendal agony. I have the surgery. The nerve starts healing. I start my warm water walking therapy 3 weeks after coming home. I'm burning both legs, both feet. Now, when I went to Austria, Dr. Osman was like, you know, you've come all this way. Let's explore your right side. Well, I didn't have any entrapment on the right side. Unfortunately, now my symptoms of CRPS have spread to the right side. Now, no doctor can really predict that because it's not like every patient that's had the transgluteal surgery or whatever got CRPS. There are a few. There are a few that I know personally that have. Okay, so that's something to consider, connection. But you know, now I mean, it's like I'm at the point now where you know I'm having to pay cash for ketamine infusion treatment. It's like I had to pay cash to go to Austria. I mean, it's not like he charged an arm and a leg, but it's Austria. I had to fly halfway across the world.
Absolutely. So, and I mean, not everybody has this kind of cash. You know, this is why we have insurance programs.
Yeah, and I still have insurance too. And this is what, you know, and these are brewing ideas in me for like when I can get better enough to have a show and actually do a show on this. But you know, I do think that it's something that people should consider. And if you are somebody that suffers from chronic pelvic pain and you have symptoms of burning that are not necessarily in your pelvis, that started around the time that you started noticing your pelvic pain symptoms, whatever, I think that you should try and get to a pain management specialist right away to see if you could possibly have CRPS, because with CRPS, the chances are, if you are not diagnosed within a year, I do know this, that the chances of you ever going into remission are like 0. So that's where I'm at. So I'm pleading with the pelvic pain community to, you know, don't be freakish about it. Like if you have a burn in your foot one day or in your toe, don't be like, oh my God, I have CRPS. But, you know, if it's something that is going on all the time say you get in the shower and your feet are burning, you're like, what is going on? The water's only, lukewarm. Well, there's some things we need to look at. And right. I just wanted to throw that out there. And I just want to close this with, like, I love the pelvic pain community. I am so thankful for all those people that pray for me, and, I'm just still believing in my miracle. I mean, I was given, I'm a very strong Christian, and I was given a prophecy when my daughter was 4 months old that God would heal my nervous system. And this was before I even found out that I had a problem with my nerve. It was about 15 months later that I was officially diagnosed with PNE. So I'm standing on that promise, and I'm just not ever going to give up until I get healed. And I think that every single person out there listening right now should try to hold on to that little small voice inside of you that's saying, I'm never going to give up. So I don't know. Absolutely. I'll just finish it with that.
Thank you, sweetheart.
And get off with that.
I'm gonna pop over to Sean because he has a wonderful petition that I want him to talk about, and I've got 9 minutes left here in the show. This went really well today. Maybe we can do a part 2. I love you so much, and thank you for calling. All right. Maybe you can do the part 2. And then I'll call in, okay?
All right, let's go.
All right.
Thanks.
All right,
bye.
Bye. Sean, are you still there, honey?
Hey, yeah.
Hey,
yeah. I know you don't have much time left.
No, we're good. We've got 8 minutes and 25 seconds, and I'm really proud of you with this petition that you have going on, and I want you to talk about it. And you and I separately, we'll get you back on here so that you can talk about all your great advocacy work, and we'll just have you on as a guest sometime. So let's put it out there though, what this petition is, where people can find it, what they can do about it. So let's hear it.
So, I really wanted to just talk about the petition really quickly in other ways. I'm trying to bring awareness to the medical community about Pudendal Nerve. And if there's any time to talk about, current or new treatments for pudendal neuralgia, urinary problems associated with CPPS, PNE or IC, I'd also like to talk about that now or in the future. But one quick thing I want to throw out is people can also search the IPPS site by state, that pelvicpain.org, for doctors in their state that may be able to help them with their hard diagnosis.
Very good point. Thank you. Very good point.
Not everybody's aware of that. So, so basically I have a petition with over 500 people now, but I just wanted to real quickly say what pudendal neuralgia is, because not all your listeners might not know what it is, but it's the pudendal nerve is one of the most important and major nerves in the pelvis, responsible for many of your important organ, pain, motor, and sensory functions in your entire pelvis, including urination, sex, orgasm, bladder function, bowel function, and pain sensation in your pelvis and your perineum, which is felt when you sit down. So it's a major, major nerve. PNE is when you have a part of that pudendal nerve compressed by scar tissue, varices, or other anatomic abnormalities.
Absolutely, and that's the point that I always try to get across to my endo sisters, is the scar tissue section of that.
Or even endometriosis. Everybody's causing case is different, but okay. So I do want to work with all the members of the IC community, and all the different, people who are trying to help IPPS. And so, anyways, the petition I created is its purpose is basically to be sent to the American Urological Society, Obstetrics and Gynecological Association, American Urological Association, American Medical Association, and many top medical schools and hospitals around the world, not just in the U.S. But so far we have over 550 signatures. I want to at least get 1,000 before sending it off. But the website is www.ipetitions.com/, petition/request-for-more-research-and-training for all.
Is there a quick website that somebody can?
If you just Google search iPetition.com and put request for more research, you'll find it right there. So quicker, easy way to find it. Unfortunately, it wouldn't let me change the name of that. But
maybe what we could do, Sean, is actually put this link directly on pelvicmessenger.org. I think that would probably make it the easiest. So for everyone out there listening, we'll get the petition link direct for you. If you just go to the pelvicmessenger.org, we'll have Jessica get it up so that people can just click directly to it. And this is something that, everyone needs. You need much more than 500 signatures. This has to be like an in-your-face yearning from our community. And I commend you that you've gotten 500. That is hard to do. It's hard to get people who are sick to be able to look outside of the fact that they're sick. I know. I just had to cancel a show last week for that exact reason. So, but this is something that so very quickly you can sign and make such a huge difference potentially. And here in this country, it's estimated that we have 30 million people suffering from chronic pelvic pain. And it does not matter what your diagnosis is. Your nerve is in some way connected to this, and that's what I think you're trying to say, Sean, when you talk about all the different areas that it takes care of. So signing this petition helps everybody. You can't sit there and say to yourself, I don't have PNE, I don't have that, so I'm not going to sign it. Like, you need to do it so that we all can get better, period.
That's with a lot of these conditions that's somehow related to the pudendal nerve.
Right. I completely agree with you.
And I also have a YouTube channel, Pudendal Nerve. It's youtube.com/Pudendal Nerve, where I've uploaded some videos on pudendal neuralgia and pudendal nerve entrapment. People can learn more about that. People can also go to pudendalhope.org, which is where I first learned about everything. A lot of it I've learned from that website, and they can donate there. Also, they are a nonprofit agency, and they also use part of the money towards bringing research for pudendal nerve entrapment and surgery and everything for that. So I want to make sure I mention that website.
Yeah,
pudendalhope.org.
That's a very good one. A very, very good website.
And there's also lists of doctors all over the world for that there on their website as well. People can also do a search for a book I wrote on Amazon Kindle, which all the profits go for PD patients, called Chronic Pelvic Pain from Pudendal Nerve Entrapment and Pudendal Neuralgia. Another fellow patient writes another book about pudendal neuralgia called the Pudendal Neuralgia Survival Guide, which will come out on Kindle soon. So there's some other things going on, as far as different ways trying to bring awareness. But I don't know, we don't have much time, but I do want to kind of, if we have time, to kind of go into, some of the current and new medications to help with the urinary.
Yeah, we're at a minute 30, we were going to talk about steroids a little bit, and
or anti-inflammatory.
I would go right to the inhaler, and then we're going to have to end it. So.
Okay. Yeah. I guess there's a medication called Semicort, which has helped somebody with their urinary problems, which is a steroid inhaler. Also, there's non-steroid anti-inflammatory medication, which some have used for treatment. I'm trying to think of the name of it now. I'm sorry, I can't think of it off the top of my head.
I think Celebrex. Celebrex was one you were going to mention.
Correct.
Yeah.
Correct. Yeah. Mhm. Also topical, Valiant topical diazepam or compounded, basically, or rectal or oral is very useful for many people with
very, very
urinary
good.
problems.
Very, very good.
Despite what it is from, so.
So Sean, you and I will talk.
We can't talk about all the different things.
Yeah, we're running out of time, but you and I will talk, and we'll have you on the show again as a guest, and we can go through all these important points and honor you as the great advocate that you are in your own show. So I do see one call here. I'm just going to say hello and goodbye, and thank you to everyone. Thank you so much, Sean.
Thank you. All right. Bye-bye.